Well, hello, everybody. Welcome back to another episode of the Doctors Changing Medicine podcast. And as always, I'm excited to be here. I'm excited about the guest I have for you today. It is Dr. Amelia Bueche, the amazing Dr. Amelia Bueche.
Mhm.
And she is an osteopathic physician. And we're going to have a conversation about burnout. And I was just looking up the data from Medscape for 2020, said that 42% of doctors reported feeling burnt out. So that's a huge problem. That's a huge number. And we're going to talk about how this doctor is tackling it, not just for the individuals, but at an institutional level. So, welcome to the show, Dr. Beaky.
Thank you so much for having me. Such an important topic to address.
I agree. I agree. So, I'm going to start off by asking what makes an osteopathic doctor decide I'm going to fix burnout? Like, how did you get here?
Yeah, I love that. And, for me, it was always about seeing the health. And in my work with this osteopathic life, I talk about being for the health of all things. And when I've worked with the osteopathic principles with my patients, it's about helping them see that they have health within. And sometimes things get in the way and interrupt it. And I see that as being applicable in systems as well, right? So some things can get in the way of a system that means well, is intended to work well, but sometimes it doesn't because we get off course or we get confused or we don't have access to the resources we need. And so I see as a direct corollary the use of osteopathic principles to address burnout, like you said, both for individuals and within institutions and systems.
So as far as you know, what is the problem with burnout, right? Like, and this is on a physician level, and maybe you can even go to on an institutional level, right? Because burnout is a thing, okay? But what's the complication, if you will, of it for the
Mm-hmm.
doctor and for the institution?
What I see is that we start to lose connection with the reason we started medicine in the first place. And then we also begin to feel like we don't have control over the situation. So medicine has changed, and we see the amount of information that's available in the practice of medicine doubles. It was like every 10 years. Now it seems like every 10 minutes, we're getting all that much more information, and it can be overwhelming. And we can feel like, what can we do as one person? And we don't have a sense of that. We don't have a sense of agency or autonomy available to us. And that can feel very disempowering, and it can feel very futile, one by one. What can we actually do? And the thing that I actually find to be most relevant to burnout is continuing to say yes. And I actually had a conversation with one of my dear friends, physicians, and coach colleagues asking me, right, when do you say no to things? And I recognize that that was a big part of my venture into burnout in the practice of medicine, because physicians want to help. They want to show up. They want to do things and make care accessible to patients. But every yes, right, can take us one degree away from our core values if we're not aware of it. Yes isn't a bad thing, right? But if we're not doing it consciously and intentionally, that can really take us off course. And it's when we have that lack of alignment between our values, our meaning, our mission, and our purpose that burnout happens. Because I picture like friction, in a joint. I work in osteopathic medicine, right? And if it's just a little bit off, it doesn't take much. If your kneecap is just tracking a little bit off, every time you bend your knee, there's wear and tear, and you might not notice it right away, but in a month and in a year and in 10 years, there's a big impact from that. And so that's what I see, is that lack of alignment with ourselves, with our values, and a lack of congruence with the institutional values and those of the individuals as well.
That is so interesting. I haven't thought about it that way, but it's actually true. So we
Mm-hmm.
set out to help
Yeah.
people for most physicians, right? That's why we went into medicine in the first place. And your plan or what you were thinking, your values, your mission is totally not lining up with what you're doing at work. And then you're just like, this is ridiculous. I love it. Okay. All right.
Mm-hmm.
So now
Mm-hmm.
for the institutions, what do they stand to lose because their physicians are burned out?
Yeah, well, they stand to lose the physicians, right? And we can see that attrition in all different ways. They can leave the practice, they can scale back their time, they can lose their life, right? We see that the rate of physician suicide is high and growing. And so they stand to lose the physician workforce. They stand to lose physicians who are engaged, right? So you might show up, right? But you might not actually be engaged and be able to be with your patients in the way that you would like to. And so even though, right, warm bodies in the room doesn't necessarily mean people who are really still aligned again with their mission, vision, and purpose. And so quality of care can be compromised if we're not caring for the people who are providing the care to the patients, right? And then that's a huge ripple effect. So if we're having the people providing the care not healthy themselves, what is the example given to patients? What does that influence wider in the community? And of course, bottom line is impacted, right? There's a cost, a financial cost when physicians depart, when care is compromised, when quality is not there, all of that still impacts the bottom line. And so then they're at risk of not being sustained, as an institution, as a business in the practice of medicine as well.
Okay, that's a lot. That's a lot. And the part that, the part that I find interesting is the unengaged physician, right? Because you think about the impact that has on the bottom line. So here you are, you have your highest earner there 50% of the time. So you're eating the cost for the other 50%. Okay, fair enough. Now, in institutions, what do you find are some of the things that are triggers, if you will, for burnout, or some of the contributing factors to burnout?
Yes, and this is a really key place to notice, is it the actual factor, right? And this is a question I get a lot of times from physicians at the individual level. If we say you have a lot of power and choice and autonomy, and then they say, well, can I just think and feel better about whatever's happening? And the answer is yes, and, right? So you can feel better about whatever's happening in the moment and absolutely still advocate for change, right? It's not just roll over and take it, just, go with whatever the system is handing you. But also, you don't have to be so distressed all the time in the midst of it while you're advocating for change, because sometimes change moves a little bit slowly. I worked in a really large healthcare system. I remember one time we just wanted to change one thing in our order set. It took 6 months just to
Wow.
get it on an agenda, right? Because all the systems had to agree on it. And you're thinking, okay, how can I be less annoyed in the process? So things that come up most often are time management, charting, volume of patients, surveys, being measured by survey results. Those are the common things that come through. And not feeling supported is another key piece that's expressed. And that could mean not having enough staff, not being listened to, not being asked your opinion when a clinical change is made. And those are the big things that come up from the individual perspective on why they're feeling burned out. And so many of those could seem like they're beyond your control. But again, there are spaces in there where you can stand up and say, right, I'm not going to see this volume of patients. Or you could notice the information from the survey and take some thoughts from it, but not make it mean anything about you and your worth, but just say, wow, that's information, and I might be able to integrate it. So there's opportunities there, and also space to say, right, if you do actually need more clinical support, reach out and make that change, right? Advocate for those pieces. And it's balancing those two of what can I do and what do I need to advocate for the system to do. That really is the sweet spot of navigating burnout.
I love it. Okay, so I'm thinking that burnout might be like depression in a way, where sometimes people don't realize that they're depressed, don't realize that they're burned out. So is there a spectrum of symptoms, if you will? Because some people are like, I'm done, I'm out. It was just too much. I left, right? But then I'm
Mm-hmm.
sure there are others who don't even realize. I hear people say, like, oh, I didn't realize I was burned out, right? So a doctor
Mm-hmm.
is listening. How do they know if this is actually something going on with them?
Absolutely. And that one was me, so I was the yes physician doing all the things. I was a high producer. My patients were happy. My scores were good. I had all the boxes checked. And then it just hit me one day. I was like, I don't think I can keep doing this, right? I don't want to go back there. And it almost doesn't make sense because you think, right? I'm doing well. I have a title. I'm making this money. My patients like me. My staff thinks I'm great. Why
It's
don't I want to go
perfect.
back? But then you think that mismatch, and that almost makes you feel worse, right? You feel bad about feeling bad about it because you're thinking, I should be happy with all of this. And so definitely that's one, right? Where you think I've got it all figured out and it's working. And I somehow don't want to return to that when I really should, right? I know I love my work. I don't love my job, right? And that's a big distinction
Mm,
to make because we
mm.
often intertwine the two. And so if I thought about it, I absolutely loved, right, seeing the patients and doing that work, but it was muddled in all those other pieces. And so the job I was not loving. And then I thought that meant I didn't love my work anymore. And so that was a big piece to notice. And there are also objective measures So I work with the well-being index when I work with individuals and at the institutional level. And so many people are surprised. I think 9 times out of 10, I get the response back, I didn't know it was that bad, right? Because it's measuring
Wow.
distress.
Wow.
And they think I'm doing okay, because we're also taught to just be okay, right? To just keep showing up. You're fine. Again, you're a physician, you're privileged, you have a high income, you have a steady job, things that we have seen and be undermined in this past year, particularly. But most people are surprised, right, by what score they get back in this validated external measure of illustrating burnout.
Wow. So let's say a doctor is thinking about these things and they're like, wait a minute. Now that I've paused to take a moment to think about it, I think I actually might be experiencing burnout. What are
Mm-hmm.
some of the tips you can say? These are three quick things to start thinking about, start doing. What would your advice to them be?
Yeah, if they're comfortable navigating it themselves, asking themselves why they think they're burned out, and give themselves 10 minutes, right? Set a time limit and give yourself 10 minutes to think about why and see what ends up on the paper. And a lot of it will be those things we talked about, right? It'll be the time and the volume and the patients and the surveys and all those pieces. And then if you're willing, look at that and say, what do I think about when I look at all of those? What am I telling myself about myself in the context of these? I can't keep up, right? I'm not going to do enough. This isn't what I thought I was going to be signing up for. I'm not taking good care of my patients. I don't have enough time. So just then start to see that distinction, right? So notice all the things, and then notice all the stories you're telling yourself about the things that are on the paper. And then the next thing you can do is look at it and say, what can I actually change, like today, right now? Next time I go into clinic, what do I have control over? And just pick one. Just pick one thing on there that you can actually control and focus on that. And maybe focus on that for the day, focus on that for the week, and see what starts to open up. And I always talk about creating space, just like in that joint friction, right? If we get a little bit of space in the patella, not grinding right up against your tibia and your femur, then you can get some benefit there. There could be some opening and a chance to start healing. And then you might look at that list of all those things and say, what really should change, not just for me, but for me and my colleagues, and ultimately me and my patients, right? Because we're still there for optimal patient care.
Yeah.
What thing on here would actually make patient care better? And then you could start to look at some steps. How can I again contribute directly? Or what's the next step in moving that forward? Who would I have to talk to? Who does have the leverage? When's the next meeting? And hopefully a meeting that's not just a talking meeting, but a doing meeting. And so that's what I would look at, right? Get clear on what's happening, find a space you actually have some control, and then acknowledge, yes, there's always room for systems reform. And what's a space that I want to invest my energy? And remember that too, like, where am I passionate? Where am I willing? Where am I able to stand up and start to effect change in that way? So that's a great starting point.
So I'm gonna pedal back a little bit because I want to make sure my listeners didn't miss this, because this
Mm-hmm.
is so simple, but it's so profound. If you're listening and you're in any way dissatisfied with work, or you're burned out, or you think you might be burned out, follow the steps, right? Like, what is triggering all this? What story am I telling myself because of this? What action can I take today to make it better? And I love that you added in, how am I going to advocate for so it's not just about personal, my personal experience, but what can I do to bring an institutional change, right? Like, that is so amazing. So tell me, like, I know about people working with people one on one, right, to help them fix this burnout thing,
Mm-hmm.
but what made you start thinking institution wide?
Yeah, I've always had the systems approach. And I've, again, looked at where can the osteopathic approach fit. I thought about schools. I have 3 young children, and we could look at the education system. I thought, ooh, this needs some help, and looking at insurance. And I was a health policy fellow last year, and just seeing like how on a big scale could we go. And then it was about a year ago, one of my colleagues put a comment on Facebook. It's like, man, we need coaching at the institutional level. Like, all my colleagues need a coach. And I had been drafting curriculum and writing proposals and having different conversations. And I kind of thought, oh, good, like somebody else too. So I said, let's meet, and then we just came together in a meeting, and then we kept meeting. And it was very clear, right, that this was desirable. And then it had been happening, right? There is coaching at the institutional level in different pockets. But again, we don't talk to one another so much in medicine. And that's been one of the gifts of 2020, in my opinion, is that we have started to cross these bridges and come out of these silos and say, oh, what are you doing? I can learn from that and not compete with it, right? And
Hmm.
actually, we can be better together. And that's been encouraging to me to see what's been happening, to see where the gaps still are and to find out how we can be part of filling them, bridging them and bringing that alignment back together.
So now you have me really curious. So talk to me about what you're doing in the institutions. Talk to me about some of the results you guys have seen in the institutions. I want to hear all about it.
Yeah, well, the coaching for institutions itself is a collective, so it started out with maybe a dozen physicians trained or training as coaches, meeting organically. And now we're up to around 70. 70 of us meet periodically, and different of us come together. And it's a lot, it's a think tank, it's an incubator space. And we'll say, hey, I want to do this. Has that worked for you? And we share ideas. And one of the places we've had the most impact is within AMWA. AMWA is the American Medical Women's Association, and they launched the Ignite program to support medical students, women medical students, and all the unique challenges there. And we had this kind of, universal kismet alignment where they needed a coaching program and we had the workforce, and we came together, and it really has helped us set forward a model to see how teaching combined with group coaching with an additional add-on of one-on-one coaching can be so beneficial. And what I love about it is, again, we have CFI, that's our acronym, which is coaching for institutions, but we also talk about cross-pollination, right? So we have people from all different institutions working within other institutions. We talk about facilitation. And so we bring forward a program in whatever way the institution needs. Sometimes they just need a little nudge, right? They have the resource and they just need to kind of see them coalesce. Sometimes they need the full thing implemented, from a needs assessment to surveys to program creation to workforce application to follow up. And we'll do that. So we'll run that spectrum of how we help. And then integration, right? So to make this just part of the culture of medicine. And our subtext is bringing health to medicine, right? So for me, again, it brings forward the osteopathic approach to the system organizational approach, and is just going to make it part of what we do, right? Reminding ourselves that we have the capacity to be well and practice well indefinitely if, right, we can get some of these interruptions out of our way and stay in alignment with those values. So we have programs at the student level, at the resident level, at the faculty level, in institutions, independent of faculty, through medical associations. So looking at like state organizations and specialty organizations. And so we're finding all these different inroads, and we're doing what we can to gather data. That is not my area of expertise, but I'm grateful to have colleagues who are much more well-versed in that space. So getting information so that we can publish and demonstrate the utility of this. And what we're seeing is well-being index scores improve, which is helpful, getting some of those objective measures shifting. And then self-reporting. And a lot of it is the aha moments where physicians say, wow, right? I didn't even know I had, like I didn't know that had any influence, like on those 2 sheets of paper you had, right? We often don't notice all the things we're telling ourselves about what's going on. And then reaching out to one another. So it's the connection is a key piece that comes forward, right? Hearing another physician's story, being coached by a physician who understands, right? When you give your download of what happened, you don't have to explain all the nuance, but they also stay objective, when they're speaking with you. And that's where we are. And it's really still at a foundational stage, but growing so quickly, and so many brilliant physicians with great ideas, and that synergy of crossing institutional boundaries has been really powerful to witness.
Wow. That you see, like you can understand my amazement at that, right? Because this is doctors changing medicine, right? Like
Mhm.
we see there's some issues here and we're gonna step up and we're gonna fix the issues. I mean that is so good. What is your dream? Now I'm like really curious. What's your dream for
Yeah. Yeah, I
SFI?
love it. And what I love is it's totally organic right now, right? We come together voluntarily, people show up and they'll ask for resources. One thing I'm very protective of is not exploiting volunteerism. That's the thing that comes up for physicians in medicine, right? So we keep showing up and taking on these tasks, and that's great, right? It's great to be altruistic. And I've walked that line of saying, let's just give it all away for free. But, right, we need sustainability. We need to honor people's time and their expertise and all of that. So that's a really hard line for me, and I'm working my best to uphold that for us, to get adequate compensation, to make these programs sustainable, to have the institutions invest. That's a really big goal of mine. Absolutely, there's totally importance for individual investment, and right, showing that matched support from the institutional level. So my big dream, right, is just to have coaching accessible at all levels of education, training, and practice. It's just the norm, right? It's not even something you have to seek. It's like, of course I have a coach, right? Just like, of course I have a physician, right? Of course I go to my well child checks with my 2-month old. I'm gonna do the same thing for me, right? What are my 2-month check-ins for my wellness? And so creating that access point where coaching just becomes available to all at all stages, especially early on. Working with the students is so powerful because if they can take that with them, right, they can take these tools with them throughout, they're going to be huge impetus measures of change in the practice of medicine. So that's my big goal. And where I see myself is being that facilitator, getting those connections and helping bring physicians to the space where they can engage. And what I love the most about the group is it's all specialties. So many times we're in our spaces, right? You only congregate with pediatricians or neuromusculoskeletal medicine specialists, which is a very small specialty. And now to be able to say, well, my colleagues are everywhere in medicine, and we all bring something different to the table from those perspectives, and bringing, surgeons in, psychiatrists, and coaching together is really profound. And it reminds us that we're so much the same, right? We often spend so much time distinguishing ourselves, but finding those core commonalities is a key part of what I see coaching for institutions doing in the practice of medicine.
I cannot even begin to tell you how happy this makes me. So now a physician is listening and they're like, well, I'm not a coach. I don't want to be a coach, but I do want to support what is going on. I do believe that physicians should have coaches. I love the idea of bringing health to medicine, and I want to support. How can a doctor support your mission, which is really our
Yeah,
mission? You
excellent
know.
question. Yes, absolutely. And what I see too is we need that facilitation piece, right? So that F part in coaching for institutions is also those relationships, right? So getting the in. So if you do have any role in leadership or you have a connection to the leadership in your organization, you can be part of facilitating that conversation. And what I find too is you don't have to coach in the programs to be part of bringing them forward, to be part of making the connection, to be part of doing a needs assessment or watching the progress of them. You can also participate in them. And that's meaningful, right? Because your testimony in being coached offers a lot to your colleagues. So there's a lot of room, right? The coaches are the primary workforce, but we also have topical teaching experts. We talk about microaggressions and we talk about finance. And so not necessarily of a coaching mindset, but we incorporate teaching within these programs as well to give skill development and tangible takeaways to our participants. So absolutely there's roles there. But that relationship piece is key, right? So getting these programs in place requires some internal knowing, right? Some relationship that's there. And there's absolutely a role for you to be part of this, right? And saying, what do we need? And then what are the continuity plans? What I love is we come in and we have programs and we create this kind of skilled workforce of physicians who now sees, oh, like these are the stories. And here's my autonomy. And here's where I'm going to advocate. And here's the boundary I'm going to draw so that we're not subject to this. So our patients get optimal care. And then long term, we have this kind of advocacy team. So when you have been coached and been through these programs, it allows you to then become a leader in that way within your institution. So many opportunities to take part in the process.
I didn't know that. And that is so well rounded because almost anybody can play a role, right? Every physician can play a role.
Mm-hmm.
That is powerful. And I want to say this, like, facilitation is like, and collaboration is like Dr. Beaky's superpower. Right. So watching you do this is
Yeah.
just fantastic. I love it. I knew about what you were doing. I did not know all of this. This is so huge and it has the potential to change medicine. And I know you'll do it. I really do.
Oh, thank you.
So
Yeah.
those of you who are
Collaboration is my
listening,
sweet spot.
it
Yes.
is your sweet spot. I love watching you in your element do it. It is your
Mhm.
sweet spot. So for those of you listening, we are on this podcast. This podcast is not just for inspiration, but this is doctors deciding we are going to change medicine. And this is a vehicle for change. So I want you to check her out. I want you to check out her website. I want you to follow her on social media. And whatever you're able to do, whatever part, big or small, which may be big or small in your mind, because you don't know what happens when you just say yes and do something. I want you to throw your weight behind it and do it. And 3 years down the line, 5 years down the line, a decade down the line, when she's like, oh, we've covered X percent of med schools and X percent of residencies and all of this stuff, you can say, wow, I was a part of that. So where can people find you?
Yes, you can visit us at coachingforinstitutions.com and you'll see a number of the coaches, you'll see our programs, articles about coaching, and that's a great place to start. And you can fill out a form, an email form that I'm interested in helping out, and that's where we are.
Awesome. Thank you so much for coming on. This is so helpful. I always ask this at the end of every interview. I'm like, this is not a podcast, this is a movement. And, there's a million of us. If we don't like the system, we can change it, right? We have the numbers. And so I
Mm-hmm.
would tell everybody, you have to share this episode, right?
Mm-hmm.
So, from your perspective, why would you say the doctors listening right now 100% need to share this episode?
The doctors listening to share this episode because they themselves have the inherent capacity to heal and to be well. And the more whole, well physicians that show up in the world, the better the practice of medicine will be. So if you listen to this and you begin to feel that shift, imagine if you were able to share that with one colleague and then another, and those million, right, all show up as healthy and whole and capable. The practice of medicine is already changed with or without the programs. So when you begin to know that you're capable of that, it automatically begins that change. So share it and share that practice, those 3 simple steps. Start to do that and see how it's different for you, see how it's different for your patients, for your families, and what that ripple effect might be.
You heard her. Share the episode. Thank you so much for coming on. Everybody, head over to her website, check it out. Is there a place for people to sign up and stuff like that?
Yes, yep, you
Okay.
can be part of coaching for institutions right through there. Yes.
Yeah. So do that. If you've been like, oh my goodness, I've always wanted to do this, then come join her and let's be the change that we want to see. So thank you so much again, Dr. Beaky, for coming on. And for everybody listening, go do your thing, and I will see you on the very next episode of the Doctors Changing Medicine podcast.